Today's 101.9 morning show. We're here in our up close to studio for another episode of GBMC's Facebook Live series. Joining me today, we have the director of the Primary Stroke Center at GBMC, Dr. James Bernheimer, and he's going to be answering your questions about the warning signs of a stroke and also the recovery following a stroke. So good morning, doctor. Thank you for being here.
Good morning, Gina. Thanks for having me.
We're so excited to have you here, and I guess the easiest way to start is saying what is a stroke for anybody who wants to know what that is and to recognize the symptoms of that.
Well, a stroke is an event that occurs in the brain, and we define it usually as a focal deficit in function, meaning a specific spot in the brain is involved and it creates a specific lack of function, whether it's weakness or numbness or vision loss or slurred speech. And specifically, because it's a vascular event, that symptom or sign reflects the blood flow distribution of a specific blood vessel. So the neurologist can examine someone and say, your stroke is in this part of the brain and in the distribution of this blood vessel based on the signs and symptoms.
Gotcha. And you are a neurologist by training, and that's how you're the perfect person to talk this morning about this topic. And a little bit more about the stroke. What happens to your body during a stroke?
Well, there are two basic types of strokes. They're both vascular events. One occurs, and this is the most common type, from a blood clot that blocks up the artery and stops blood flow to a particular part of the brain. Mm-hmm. And then that part of the brain, those nerve cells, when they become damaged, that produces the symptoms of the stroke. The other type, which is less common, is actual bleeding into the brain.
Okay. And then what is the difference between, you hear the term left brain stroke versus, is the other option right brain? And if so, what is the difference? And oddly enough, it's very timely that we're talking about this topic because my dad, about 6 weeks ago, had a left brain stroke. And he's in advanced age at this point, which we can touch on that, about factors of risks of a stroke and things like that. But what is the difference, say, in my dad's case with the left brain versus, you know, another option with the right brain?
So broadly speaking, one side of the brain controls the opposite side of the body. Mm-hmm. So with a stroke in the left side of the brain, you would normally get weakness, sometimes vision loss, sometimes numbness on the right side of the body, and it would be just the opposite for a stroke in the right brain. But certain functions are what we call lateralized, meaning only one side of the brain handles it. Mm-hmm. And the most important of those is language function,
right,
which for pretty much all right-handed people and about half to three-quarters of left-handed people is in the left side of the brain. So we see language problems, difficulties communicating that go above and beyond just slurring of the speech, mm-hmm, much more commonly in a left brain stroke compared to a right brain stroke.
And in that case, that might be like you the patient trying to find the words, but maybe not saying what they're trying to say. You know, what comes out isn't what you're...
It tends to come in two flavors. One flavor is an expression problem, where the patient knows in their head what they're trying to get out and they can't come up with the right word, mm-hmm, they can't find the words, they use the wrong word.
Right.
That can also manifest in writing as easily as it can in speech. Mm-hmm. And the other kind is a receptive problem, where patients don't understand what's being presented to them. They lose the understanding of language.
Right.
And patients who have that produce lots and lots of words, but they often don't make any sense.
Exactly. And is that common in the beginning? I know that therapies and that sort of thing can help along the way as, you know, your care of a stroke patient. But in the beginning, sounds common that might be what happens?
Well, which one of those two types of problems you have, the expressive language problem or the receptive problem, mm-hmm, really depends on exactly where on the left side of the brain the stroke is.
Right.
And rehabilitation is actually much easier with the expressive problem because the patient retains an understanding of what's being told to them, where it's oftentimes hard to redirect someone who has the other type of language disturbance.
Right, wow. And are there telltale signs of a stroke that, you know, I think my mom thought that my dad wasn't making any sense anymore and he was very lethargic and didn't want to get out of bed, things like that. She just knew that it wasn't normal behavior for him, mm-hmm, and she knew to take him to the local hospital. So if someone that's watching our Facebook Live today with GBMC, with Dr. James Bernheimer, the director of the Stroke Center at GBMC, if they see that and recognize those, you know, characteristics in someone, what should they be looking for?
Well, stroke is a little bit tricky because the signs and the symptoms change depending on what part of the brain is involved. And it's a little bit easier, for example, to say these are the signs of a heart attack because they're almost always the same from person to person. But the signs of a stroke can be very different from person to person depending on which part of the brain is involved. But the key is first recognizing that there's some sort of deficit in neurological function. So, and we've talked about a few already. So the language function is one. What's even more common, because it could occur with either side of the brain, is that because there's weakness of facial muscles, there can be slurring of the speech and drooping of the face. You can get weakness on one side of the body or the other, numbness or sensory loss on one side of the body or the other, or vision loss to one side or the other.
Gotcha.
And sometimes double vision, depending on the part of the brain that's involved. There's actually a nice, easy way to remember some of the main signs of stroke. It's an acronym we call FAST.
Okay.
And the F stands for face, the A stands for arm, and the S stands for speech. And the way that acronym works is if the face is drooped, or if you ask someone to hold an arm up and they can't keep it lifted and it drifts, or their speech is slurred or altered, each of those three things is a pretty common sign of stroke. And depending on the study you look at, if you have one of those three things, between 70 to 80% of the time, it is indicative of a stroke. So those are three things that you can check in a loved one if you're worried about a sudden change, that can say, hey, yes, I recognize this as a sign of stroke, and get them to the hospital right away by calling 911.
Right.
And that's what the T stands for. The T stands for time.
Gotcha.
And it's a reminder to act fast, because we have lots of treatments for stroke that have short time windows. There's a blood thinning medication that's ideally given within the first 3 hours after the onset of symptoms. There are clot devices that can go into the artery and remove the blood clot. That's ideally done within 6 hours. So it's really important to seek medical attention as soon as possible.
Time is of the essence, for sure. So is that, do you need to wait for it to be diagnosed as a stroke before you can start doing those things? Or is that, you just kind of do the best case scenario based on those telltale,
Well, usually,
signs?
the formal diagnosis becomes the job of the emergency department physician or the neurologist. So, if you have one of those signs, there's a and certainly if you have more than one, there's a really high likelihood that that's what you're dealing with. And so from the patient standpoint, you should say, this might be a stroke. We should get there
Act swiftly
as soon as possible.
Great, very good advice. And Linda is typing in, we have a question on our Facebook Live as well. She wants to know what causes a stroke, and then we also are going to get to some more questions from the audience. We're also going to have social media coordinator Mindy Shiflett, who's in the crowd today with us, helping to field questions. But first up, for Linda's question, since she's been waiting a minute, what causes a stroke?
Well, that's a great question, Linda. Like as I mentioned earlier, there are two main types of stroke. One is bleeding into the brain, and one is a blood clot in the brain. And the bleeding into the brain is much less common. That's only about 15% of all strokes. And usually the most common cause for that would be high blood pressure that damages the blood vessel so that it breaks open, or an aneurysm in the brain. The more common type of stroke caused by blood clots is multiple different ways that can happen. It can be damage to the wall of the very smallest blood vessels in the brain, which is usually caused by high blood pressure as well. It can be clot that came from your heart and was pumped to the brain, and that happens a lot with a particular irregular heartbeat called atrial fibrillation. Or just like you can get plaque on your coronary arteries from high cholesterol and diabetes and high blood pressure and smoking, you can get plaque on the arteries in the brain from that as well, and that can lead to those being clotted off and cause a stroke.
Actually, I forgot, Linda has a two-parter here, Doctor. She also wants to know if stress is a contributing risk factor for stroke, when we get into more of the topic of risk factors that contribute to having a stroke, if that's one of them.
Probably not as much as it is for a heart attack, because when you're stressed and there's lots of adrenaline pumping, your heart beats faster and increases its demand for oxygen, so there's a more direct connection there. But indirectly, stress raises your blood pressure, which is the major modifiable risk factor for stroke. So absolutely.
Gotcha. So Mindy, you had a question from our Facebook Live viewers?
We do. It's actually from Greg Carpenter, your co-host.
Oh, wow. Yay. Thank you, Greg.
And he wants to know, is there a common therapy to assist in recovery?
Ah, good question.
So following a stroke, usually recovery consists of some aggressive physical therapy and rehabilitation, sometimes speech therapy if language and speech are involved, and that's usually the main approach.
Thank you, Greg, for your question. And people can pose questions right now throughout this Facebook Live on our GBMC Facebook page. Feel free to chime in if there's something here you'd like to ask Dr. James Bernheimer, who is the director of the Stroke Center. How about this one here, Doctor? If you have a heart attack, are you more likely to suffer a stroke?
You are, for two reasons. Sometimes damage to the heart muscle that makes the heart pump less effectively allows blood to pool in the chambers of the heart, and clots can form there and then be pumped to the brain. And also simply because all of the risk factors we discussed for stroke are the same as the risk factors for having a heart attack.
Right.
It's age, high blood pressure, high cholesterol, diabetes, and cigarette smoking.
Wow. So all those things we should be mindful of. And I guess I should ask this question given that my dad had one. Are strokes hereditary?
Not specifically, but a lot of people have hereditary predispositions to those risk factors, like the blood pressure and the cholesterol and the diabetes. So there's some, so yes, you're at a little bit higher risk if you have a family member who had a stroke. And just like with heart attack, you know, your family or your genetic risk is probably higher if you have a family member who had one at a younger age than we would normally expect, as compared to, you know, having one at an older age where they're just more common in the population.
Right. I was going to ask if that was more common because a friend of mine from college, her mom had one at just 36 years of age, and is still, you know, thriving and recovering. It is possible, which kind of leads us into our next question, versus someone who just sort of was brought on by those factors that you mentioned, as well as the advanced age. But how likely are you to have a full recovery, hopefully, following a stroke?
Yeah, it depends on what study you look at, but in different studies it varies anywhere between, and this is without getting one of those treatments that, that we were talking about earlier, it varies between 20% and 40 to 45%, so roughly a third of people will have a pretty full recovery, meaning they can return to pretty normal activity afterwards.
Great, great. And then how long, I know it probably varies depending on the severity and whatnot, but generally, how long is the recovery from a stroke?
It usually takes a very long time. The maximum recovery can be anywhere between 6 months to a year.
And Mindy has Mindy Shiflett, social media coordinator at GBMC, who does a great job with our Facebook Lives here, has another question from the crowd.
Yes, we do have the question of how should you balance the post-stroke patient's need to sleep with the need to stimulate the brain to restore cognitive and speech functions?
Excellent question, because is sleep a part of the recovery?
That is a very good question.
Yeah,
well, sleep is just so important for health, independent of whether you've had a stroke or not. That is certainly important to make sure someone's getting enough rest.
Right.
It's also important to have pretty regular schedules and to encourage that during the rehabilitation. And so that can sometimes be a pretty tricky balance, particularly if there are other medical issues involved that might be contributing to the tiredness or the fatigue.
Great, thank you. And then once you do have a stroke and there is brain damage, is there any way to rejuvenate those brain cells to come back, or do they just die and never function again? This is another question that came in here. It says, my niece had a stroke and lost the ability to move or speak. Occupational, physical, and speech therapy did not do anything to improve her mobility or speech. So that's in their case, they had that question, that experience. So is there any way to rejuvenate those brain cells to come back?
With our current technology, no. And usually the way people recover from a stroke is it's twofold. Number one, while they're having the stroke, either we've done a procedure to restore the blood flow quickly, or they have what we call collateral blood supply, which means they have other blood vessels that sort of feed the same area, so that although they have a big deficit when they present, that extra blood flow that we give them helps some of the brain that hasn't quite died yet recover and function. And then the other way that people recover from a stroke is that over time, parts of the brain that used to do thing A learn how to do thing B, and help recover function, even though the original brain cells that used to do that function are dead.
So is a lot of it like moving forward from that point where you are now, rather than, you can't necessarily go back in time to the exact spot you were before the stroke, but maybe from that point on, focusing on your progress and where you can move forward from that point.
Well, that's very true, because, it's if we define sort of a good recovery as being able to return to all your normal activities of daily living afterwards, even if you still have some residual symptoms, like I said, that happens about a third of the time. So unfortunately, for the other 2/3 of people who suffer from a stroke, they're going to have some residual difficulties.
Right, right. And something you hear bantered about a lot are strokes and TIAs. So if you can explain what that acronym of TIA is and how they're different, and how our focus has been on strokes today, but how are strokes and TIAs different? And maybe explain that to the audience what those are.
Sure. Well, the acronym TIA stands for transient ischemic attack, and ischemia is a medical word that simply means lack of blood flow.
Gotcha.
So the term itself means there's a lack of blood flow to a particular part of the brain for a temporary period of time. And so basically it's exactly like a stroke, except that something happens to dislodge the clot or restore the blood flow. And when the blood flow is restored, the symptoms completely resolve. And we usually define it as if the symptoms resolve in 24 hours or less, then we sort of term it a TIA, provided there's no associated imaging that would suggest there was damage to brain tissue.
Gotcha. And how is that accomplished, the imaging that you do?
Usually it would be an MRI.
MRI,
scan, yeah. And so it means you're at very high risk for having a stroke, and so it's important to take those very seriously. But it's sort of analogous to sometimes people who have coronary artery disease may have chest pain that we call angina that's not damage to the heart muscle. That's like the TIA. And then the actual heart attack where the heart muscle's damaged is like the stroke where the brain tissue is actually damaged.
So how likely is it that multiple strokes and or TIAs can occur in the same or relatively the same location of the brain? Is that kind of common or uncommon?
That sort of depends on what the underlying source of the stroke was in the first place. And we talked about earlier sort of three main types: the small vessel ones, the larger vessel plaques, or blood clots from the heart. Well, blood clots from the heart can go to different places,
right?
Almost randomly, it would seem. But if you had a narrowing of a particular blood vessel, then yes, your future stroke is most likely going to be in the distribution of that same blood vessel.
Gotcha. And then can the damage caused from that result in any accumulative after effects?
Well, you can certainly have residual whatever deficit you presented with, whether it was vision change or speech change or weakness or numbness, that can persist. Multiple strokes in different parts of the brain over time can be a source for cognitive loss over time. People may be familiar with the term multi-infarct dementia or vascular dementia. That's what that refers to.
Gotcha. Now, as the director of the Stroke Center at GBMC, how much of your work is on the preventative, the warning signs of it? Is that also part of your job too, to recognize in your patients the risk of a stroke, and how important is that to sort of hopefully not have a stroke?
Well,
and avoid this.
So
completely.
I sort of wear two hats.
Yeah.
As a neurologist, I see patients in the hospital and in the office, and usually I'm not being asked to see patients until the horse is out of the barn and they've already had the stroke.
Right.
But as the director of the stroke program, we certainly have community outreach efforts where we're trying to attempt to educate the general public about warning signs and about risk factors, and we do blood pressure screenings and that sort of thing.
Oh, that's great work. That's very important. And you can save a lot of lives that way.
No, that's exactly right. I mean, because 2/3 of people roughly are not going to achieve functional recovery, prevention is really important.
That's the key, right? And Mindy, you have another question from our Facebook Live from one of our viewers.
This is actually coming from me, this question.
Oh, cool.
So you were talking about left brain and right brain strokes. Are the symptoms different or the signs different from the different types of strokes?
Very good question.
Yes, good question, Mindy. So they can be different, as the left brain is more commonly associated with language function. So it's a little bit unusual to get language dysfunction from a right brain stroke. On the right side of the brain is often concerned with spatial relationships and emotional content. So sometimes patients with right brain strokes may lose the ability to recognize the emotional content of speech. So, for example, they can't distinguish between when someone says, "Hey, that's great," and "Great," you know.
Right.
And the other thing they lose is a sense of space. And so sometimes not only are they weak on the left side because the right brain controls the left side of the body, but they don't even realize it. They don't even recognize their left side. And that can be also difficult for rehab purposes.
And we have yet another question. Mindy, is this yours or
This
from
is
one
mine.
of our?
This is mine
Yeah.
too. I just wanted to let everybody know how to reach out to Dr. Burnheimer.
Oh, what a great idea! Yes.
If we can show the phone number.
Yes, so that is for if they want to call the Stroke Center at GBMC, you can do that at 443, the number on your screen, 443-849-4145. And Doctor, what hours are you open and available, or is there a certain time of day that you take calls, or you'll get back to people when you can, or how's that work?
Our office is open as we see outpatients there from Monday through Friday from 8 a.m. to 4 p.m. And usually messages are left for the physicians, and we can return them at our convenience.
And another great aspect I love, I'm also a huge patient of GBMC doctors as well, and your patient portal is like nothing I've ever seen. I mean, whether it's asking a question of the doctor or medical test results or prescription refills or whatever it is, that's an amazing online resource as well. So how can they do that online as well, Mindy or Doctor, if you want to mention that? To get more information online about the work that you do.
The website is gbmc.org/stroke.
gbmc.org/stroke. Excellent.
And you can click the link in the Facebook Live description.
Very cool. And keep those questions coming, and as we see them, of course, we'll be able to answer them if we haven't caught them in today's Facebook Live yet. Is there anything, Dr. James Bernheimer, that you that we have forgotten to ask you, or anything else that you wanted to let our viewers know today about the Stroke Center at GBMC, or any other words of encouragement out there for anybody who might be dealing with themselves going through a stroke or their family member?
Well, I would certainly like people to know that GBMC is a certified primary stroke center by both the state of Maryland and the Joint Commission, which is the entity that accredits hospitals nationwide. In the state of Maryland, EMTs are directed to bring patients with suspected stroke symptoms only to certified stroke centers. And it underscores what we were talking about earlier about recognizing some of those signs, acting fast, calling 911, and getting to the hospital, because we can increase those chances of you being in the full recovery group with some of those early treatments. And the other thing I'd like to drive home again is just the major risk factors. We can't alter people's age, but people can take control of their blood pressure and their diabetes, their cholesterol, and certainly work with your primary care physicians to try to quit smoking if you're a smoker, to reduce your risk of stroke.
Excellent advice, and great reminder to be acting very quickly in that critical time where you can really help aid in the recovery from a stroke as well, should it be going down that path.
Time is brain.
It really is. Thank you so much, Dr. James Bernheimer. I could talk to you for another hour and a half, but we are going to wrap things up today for this episode of Facebook Live with GBMC. Our next Entercom Facebook Live is June 6th. Mark your calendars at 11 a.m. with our GBMC experts here. We look forward to watching in the future as well. And thank you so much for watching today. It's Gina Kresh. Thank you, Dr. Bernheimer.
Thanks so much, Gina.
Thanks for all you do at GBMC. And you guys, thank you so much for watching. We'll see you next time.